If you've ever found yourself in bed, wide awake, frustrated by a persistent cough that just won't quit, you're not alone. Nighttime coughing is a common complaint that disrupts sleep for millions of people worldwide. It's more than just an annoying symptom. It can interfere with your ability to rest, impact your overall health, and even signal underlying conditions that need medical attention. While a cough is the body's natural way of clearing irritants from the respiratory tract, when it becomes frequent or chronic, especially at night, it can be a sign that something more is going on. Understanding why coughing worsens at night and what you can do about it is the first step toward getting the relief and the sleep you need. So, why does coughing seem to get worse as soon as your head hits the pillow? During the day, gravity helps keep mucus and irritants moving downward and out of the airways. But when you lie down, that same gravity can actually work against you, allowing mucus to pull in the throat or postnasal drip to increase. This triggers the cough reflex more frequently. Additionally, your throat and airways may be more sensitive in a quiet environment where every tickle or irritation is magnified. For people with asthma, GERD, or allergies, nighttime is a particularly vulnerable time. The body's natural hormone levels shift while you sleep, which can affect inflammation and bronchial sensitivity. As a result, even a mild underlying issue can be amplified into hours of nonstop coughing. One of the most common culprits behind nighttime coughing is postnasal drip. This happens when excess mucus from the nose and sinuses drips down the back of the throat, particularly when lying down. It's often caused by allergies, sinus infections, or even changes in humidity and temperature. As the mucus accumulates, the throat becomes irritated and the body responds with a cough to try to clear it. Similarly, gastroesophageal reflux disease, or GERD, is another frequent cause of nighttime coughing. When stomach acid backs up into the esophagus, it can irritate the throat and trigger a reflexive cough. Lying flat makes this more likely, as it allows acid to travel more easily into the upper airway. Asthma is also a key factor to consider. Many people with asthma experience worsening symptoms at night, a condition sometimes referred to as nocturnal asthma. The airways become more inflamed and constricted, which can lead to wheezing and persistent coughing, especially during the early morning hours. Cold air, allergens in the bedroom, and poor indoor air quality can all contribute to this nighttime worsening. Even people without a formal asthma diagnosis may experience airway hyperresponsiveness that is more pronounced at night due to natural circadian changes in the body. Another factor that contributes to nighttime coughing is the presence of environmental irritants in your bedroom. Dust mites, pet dander, mold spores, or even certain types of bedding can act as allergens, triggering an immune response that leads to inflammation and coughing. If your room is too dry, especially during winter months when heating systems are running, your airways can become dehydrated and irritated, leading to a dry, hacking cough. Conversely, if the room is too humid, it can promote mold growth and worsen symptoms for sensitive individuals. Balancing the air quality in your home is essential when trying to manage chronic coughing. Even common colds and respiratory infections can set off a coughing fit that lingers long after the main symptoms have faded. Often, after the body fights off an infection, the airways remain sensitive and inflamed, causing a post-viral cough that can last for weeks. This is particularly frustrating at night as the coughing tends to be more noticeable and disruptive when you're trying to rest. It's important to remember that rest is a vital part of the healing process, so finding ways to reduce nighttime coughing can actually help your body recover faster. So, what can you do to stop coughing at night and finally get a good night's sleep? The first step is identifying and treating the root cause. For postnasal drip, managing your allergies or treating a sinus infection may offer relief. Using a saline nasal spray or nasal irrigation before bed can help clear mucus and reduce throat irritation. Propping up your head with an extra pillow or elevating the head of the bed slightly can also prevent mucus from pooling in the back of the throat. For people dealing with GERD, avoiding food and drink for at least 2 to 3 hours before bedtime and sleeping with your upper body elevated can reduce acid reflux and its associated coughing. If asthma is part of the problem, working with your doctor to adjust your medication or add a nighttime inhaler may make a significant difference. Using a bronchodilator or anti-inflammatory medication before bed can help keep the airways open and reduce nighttime symptoms. For environmental irritants, it's essential to make your bedroom as allergen-free as possible. That means washing sheets and pillowcases in hot water once a week, using hypoallergenic bedding, vacuuming regularly with a HEPA filter, and keeping pets out of the bedroom. An air purifier with a HEPA filter can also help remove particles from the air that might be triggering your symptoms. Humidity also plays a critical role. If the air is too dry, consider using a humidifier to keep the moisture levels between 30 and 50%. This can soothe dry airways and make it easier to breathe at night. However, it's equally important to keep the humidifier clean, as bacteria and mold can build up inside and worsen respiratory issues if released into the air. On the other hand, if your home is already humid, using a dehumidifier can help create a more balanced environment and prevent mold growth that can exacerbate coughing. In addition to environmental changes, certain home remedies and over-the-counter treatments can provide temporary relief from nighttime coughing. Drinking warm fluids like herbal teas or warm water with honey can coat the throat and reduce irritation. Honey has natural antibacterial properties and can act as a demulcent, helping to soothe the mucous membranes. Cough suppressants, expectorants, or throat lozenges may also help, depending on the type of cough you're experiencing. It's always best to consult a healthcare provider before starting any new medication, especially if your cough is chronic or has lasted longer than a few weeks. It's also worth noting that stress and anxiety can play a role in nighttime coughing. Some people unconsciously hyperfocus on their breathing or throat sensations when trying to fall asleep, especially if they've had previous nights of interrupted rest. This heightened awareness can actually make the coughing feel worse or more frequent than it really is. Practicing relaxation techniques before bed, such as deep breathing, meditation, or gentle stretching, can calm the nervous system and help prepare the body for restful sleep. In some cases, chronic nighttime coughing may be a sign of a more serious underlying condition. If your cough is persistent, worsening, or accompanied by symptoms like unexplained weight loss, night sweats, blood in the sputum, or severe fatigue, it's important to see a doctor. Conditions such as bronchiectasis, tuberculosis, heart failure, or even certain types of lung cancer can present with a chronic cough that worsens at night. Early diagnosis and treatment can make a significant difference in outcomes, so don't ignore your symptoms if they persist. Sleep is one of the most powerful tools our body has for healing and restoration, yet a nightly cough can rob us of this essential function. When you don't get enough sleep, your immune system becomes less effective, your mental clarity declines, and your ability to fight off infections diminishes. That's why taking control of nighttime coughing isn't just about comfort, it's about protecting your long-term health. Fortunately, by making a few simple changes, addressing underlying conditions, and staying consistent with healthy habits, you can significantly reduce your chances of being kept up all night by a nagging cough. To sum it up, nighttime coughing is often the result of a perfect storm of factors: postnasal drip, acid reflux, asthma, dry air, allergens, or lingering effects of a cold. By understanding what's causing your symptoms and taking practical steps to manage them, you can finally enjoy uninterrupted, restful sleep. And that's not just good news for your night, it's a game changer for your days as well. So the next time you find yourself coughing into your pillow, remember, there are answers, there are remedies, and you're not alone. Thank you for watching this video on how to stop coughing at night. If this helped clarify your symptoms and gave you practical steps for better sleep, be sure to like the video, subscribe to our channel, and share it with someone who could use a better night's rest. Stay well, stay rested, and I'll see you in the next video. Have a nice day, and thanks again for watching.